Assalamu alaikum, and a very good morning to all the honorable guests and participants. We are going to start our session, which will be chaired by our honored Professor Masood Sadiq, which is the president of PPA, General Salman, Professor Mohammad Hussain, and Dr. J. Krishan. Our first speaker of plenary session 1 will be Dr. Zishan. Dr. Mohammad Zishan. It's a great honor to have Dr. Mohammad Zishan with us, who will deliver a talk regarding the crucial topic of the time being, which is the screen time. Dr. Mohammad Zishan is a recognized leading expert in psychiatric care with special expertise in infant, child, and adolescent psychiatry. He has done a child and adolescent psychiatry fellowship at Harvard Medical School, Boston Children's Hospital. He currently serving as an assistant professor of psychiatry at Rutgers Medical School, New Jersey. Dr. Zishan is also a certified master parenting coach and Maxwell leadership coach. Dr. Zishan, kindly proceed.
Yeah, thank you again for giving me this opportunity. Really grateful for all the honorary organizer, our speakers, and all the participants. So let me start a little bit about neuroscience, and then we'll go into why teenagers or kids, they use screens, and then what are some practical strategies. So brain has two parts. One is a thinking brain, which is prefrontal cortex behind our forehead. The other is an emotional brain, which is lower part of the brain, fight and flight. So Dr. Dan Siegel show this hand model of the brain, where he shares that these fingers are like our thinking brain, like planning, organizing, and our palm is our emotional brain. In a normal situation, the thinking brain is covering our emotional brain like this. But whenever we are under stress, whenever we found, our kid is doing something that was not expected to, or whenever we are getting into arguments, so our lower part, which is fight and flight, gets so activated that it hijacked the thinking part of the brain. And Dr. Dan Siegel say that it basically flipped the lid. So in those situations, when the emotional brain hijacked the thinking brain, so we act more as a fight and flight, and we may say things, we may do things, we may act in a way that may be more scary, the words can hurt feelings. So just to remind a little bit, in those situations, when we are under stress, which part of the brain is acting. The second thing which I would like to mention, with all the kindness and empathy to the parents, there is no perfect parenting. In a normal parenting, 70% of the time, parents make mistakes. So this is a really good research ghost in the nursery from Dr. Selma Freiberg. So Dr. Selma Freiberg explained, the parents like us, when we were children, the way we were being raised, let's say if we are being raised, or even if we have seen, when we were growing up, punishment, yelling, screaming, hitting, or, all those ways to us to raise. So all those memories, when now we grow up, now we are doctors, engineers, different specialty, different profession, all those memories that happened to us in our childhood, our brain forgets it, but our body remembers it. Okay, it's a very ironic that our brain remember all those memories, but our body remembers it. And the moment we see our children, using this phone, or we agreed to not use it, but they are using it in the middle of the night. So instead of trying to understand, our body go into rage. How can my child disrespect me? How can my child try to manipulate me? How can my child, try to act smarter than me? And our brain, our body go into rage without thinking, because all those memories, we start thinking, if I have done this to my parent, my kids even don't know what could have done. So all those memories that we have seen growing up, our body immediately overreact because of those memories. So when we overreact to the situation because of the way we grew up, so we are acting as a ghost in the nursery. So let's start with why our children and teenagers, they are so addictive to these screens. So Dr. Dan Siegel again say that every child, and I strongly believe every adult as well, want to feel seen, want to feel safe, want to feel successful, want to feel soothed, and want to feel significant. And you can see there is nothing wrong, to have those feelings. हम जो भी काम करते हैं, हमारी कोशिश ये होती है कि कि जो हम काम करें उसकी इम्पोर्टेंस हो, लोग उसको अप्रिशिएट करें, हमें अच्छा लगे और हमारे काम से दूसरे लोग जो हैं वो इंस्पायर हों. So Dr. Dan Siegel said these, whatever we do, either as children or adult, we do things because of these 5 S's. But these screens become toxic when we get all those 5 S's only from the screen. Okay? How to be seen, how to be safe. Seen mean, let's say, if I post on a Facebook, if I post on an Instagram, if I post on a TikTok, and I see so many people are watching, so many people are commenting, so I am feeling I'm being seen. Feeling safe, that is also very ironic. How can you feel safe on the social media? You know what, we usually don't like is usually, if we make friends, we try to know them, try to know their family before we make any new friend. But in social media, in the social world, we saw someone picture, we have common friends, and we have similar kind of posts, we watch similar kind of movies, we like similar kind of restaurant. So it's seen there are some alignment, and we are more likely to make friends because we know that if someone said something that you don't like, we can easily unfriend them. In real life, that doesn't happen. So we feel more safe making friends, we feel more safe unfriend them, we feel more safe saying things that we may not say in front of their face. So we feel more safe in doing those things in this virtual world. Feeling successful, similarly, let's say we are doing a podcast and a lot of people are commenting, saying good things. So we are feeling successful, feeling soothed. Many times that even a 1-day-old baby, if you give the phone to them, the baby start calming. You can give the phone to the 10-year-old, to a 70-year-old, everyone start feeling soothed and calm. So the phone nowadays can be the most cheapest nanny that you can have, because whatever age you can give it to them and they feel soothed. Significant is also the same thing. So what I'm trying to say is the reason our children are so addictive to these screens, because they are getting all those 5 S's only from the screen. So goal of my presentation will be how we can help our children to get some of the S from other activities as well. They can feel seen, safe, successful, soothed, significant, maybe not all 5 S, but some of the S's from other activities as well. So I will share a couple of resources for you as a physician, for you as a parent. American Academy of Child and Adolescent Psychiatry, AACAP.org, and these are all freely available. They have screen time fact sheets that you can use it in your clinical guidelines on media use and mental health. Tip for physician counseling families. So they have good resources there. And I will talk a couple of things in detail. So American Academy of Pediatrics have family media plan, which I will go a little bit more detail. Similarly, they have evidence-based media guidelines by age. And there are some other research on screen use as well. So one of the reasons that I was telling you before about the 5 S's. So remember, if we want our children to not use this phone, not use this screen, just simply taking away the phone, just simply, blocking their Wi-Fi, just punishing them, or, to not have it, usually does not help the situation. So if we want our children to use less screen time, we need to create those activities where, those offline activities where they feel seen, safe, soothed, and significant. Sometimes that means inviting friends. So Dr. Mala was mentioning, she has her kids' friends are at their house. So these are some activities that we can have friends over, we can have activities together, we can have family dining out, we can shopping, movie time, all these activities which are many. So I have my child psychiatry practice. Many times parents come, we are spending so much money to have the piano lesson for our kid. But then I ask, does your kid like piano? If the child is not into piano, if the child is not into chess, if the child is not into cricket, so you need to find activities that the child find more interesting so that they have some scenes to significant successful. Let me go over a little bit on the family media plan, how we do in the clinical setting, and I do all the time with my patients. So family media plan is that we sit with the parent and the child. We ask the child how many hours you want to use the phone or the screen or play video game, all in the same umbrella. Then we ask parents what activities you want your child to do. So usually, what parents want, they want their child to sleep on time, finish homework, eat healthy, have some family time, have some social activities or gatherings. So then we sit with the child and then we come up, these are the 5 things. Make sure, you do your homework, make sure you eat, let's say, eat on time with the family, make sure you sleep by 12 a.m. or 11 p.m., whatever the time it is, and make sure, before you go to bed, 1 hour before you go to bed, you cannot use the phone, and you can have some outdoor activities. So as long as you're finishing your homework, doing all those things, whatever the rest of the time you have, you can have access to the social, to the screens, to the phone, to the video game. So when we have these parameters, so that's how we try to help them to use it in a more healthier way rather than more in a toxic way. Many time parents come, Dr. Zishan, these things, it's very funny. They say, Dr. Zishan, these things doesn't work in our kids. वो कहते हैं जी जब तक बच्चे को दो ना लगाएं और खींच कर ना लगाएं वो समझता नहीं है. So, so how we can help in those situations? वो कहते हैं जी हमने family media plan भी बना लिया, we have done everything, but our child, we agreed to not use the phone at 11 p.m., but now we found our child using it at 1 a.m. So what should we do? So let me talk about the 5-step strategies when we made a family media plan and we found our child, using it or misusing it in the middle of the night when the child not supposed to. Before I go to that 5-step strategy, let me share you another example. I was at a conference. One of my colleagues, she came to me. She said, Dr. Zishan, I have a daughter. So, and I have been, very kind, listening, empathic. But one thing really, shaken me to the core. And I said, what happened? She said, I was at a wedding and, my daughter was talking to her cousins and she was telling, मुझे पता है कि मामा को पागल कैसे बनाना है. मामा ने मुझे मारना तो है नहीं, डांटना भी नहीं है. तो इस वजह से जो है ना, I can, manipulate in a way, and I can, use a little bit more screen time and this and that. तो उसने तो मामा, so my colleague, she said, so when I heard, it really hurt my feeling. और फिर मैंने उसको बताया, ठीक है, मैं आज के बाद माँ बन के बताऊंगी. तो मैंने कहा फिर क्या किया? कहती है उसके बाद मैंने जो है ना उससे करना शुरू कर दी. So, and then I asked, okay, so then what happened? She said, gradually, we used to have a very close friendship, but now gradually she started hiding things from me. She started not talking to me. We are getting into fights. But Dr. Zishan, you tell me, what should I do? Can I just let my child to manipulate me? Let my child to do whatever they want? Let them use the screen time, with all my, sending them to the school, doing a big birthday parties? What do you think we can do? And parents many times feel very helpless. So this is what I share with her. I said, when you were in that situation, and when you heard what your daughter was saying, it was painful. But did you go to your daughter and told her that, listen, I have been raised in a, difficult situation, but I am trying so hard to be kind, to be empathic, to be gentle, to learn and to improve. And, but when I overheard that statement, what you are saying to your friend and making fun of me, that really hurt my feeling. Somehow, sharing It's very easy to take away the phone. It's very easy to get mad at them, but sharing with them what they were doing hurt my feeling is just so hard. And our kids never know why our parents are doing it. We may think that our kids, they may understand, but unless we say these things, remember the hand model of the brain, the fight and flight. Whenever we are in that stress, our thinking brain, our as a parent and the child, both thinking brain is already hijacked. So if we don't talk to them when they are calm, and tell them, how much it hurt, is very hard for them to understand. So it's very important. So let me go to this 5-step now. So what this 5 steps say, whenever you find your child doing this kind of silly stuff, manipulative stuff, trying to smart stuff. So the first thing you remind yourself, the more I stay calm, the better I'm going to help my child. Okay? Because there is no way that if both are you are acting through your emotional brain and your thinking brain are hijacked, there is no way anyone is able to have a meaningful conversation. And I will encourage you to think about those situations where you were trying to help your child, but the more you are trying to help, the more things were getting worse, because it's not that what you are saying was wrong. It's not that your child was not, spoiled or disrespectful. It's just the both of your brains were in an hijacked situation where you are all acting with an emotional brain, not a thinking brain. So the first step, you remind yourself, no matter how hard it is, that when you agreed to your child to not use the phone by 11 p.m. and you found them at 1 p.m., it's very hard to stay calm. But the first thing you remind yourself, the more I stay calm, the better I can help my child. The second step is validate the feeling. Dr. Dan Siegel said, name it to tame it. Remember the hijacked thinking brain? If we want our child thinking brain to get active, we have to name the feeling for them. And naming the feeling is from the thinking brain. So you can say, it must be really embarrassing. It must be really frustrated. It must be really disappointing. It must be really angry for me to find you using this, phone in the middle of the night when we agree. So you say, you don't need to be a child psychiatrist. You just say what you see. I always remind parents, you know your child the best. Don't let anyone to take away that privilege from you. The third step is collaboratively explore with your child. Ask them. I call it a Dr. Z 10-minute rule, that use the 10-minute, no judgment, no right and wrong, no advice. Okay, so just ask them, we agreed you are not going to use at 11 p.m. What is going on that you are using at 1 a.m.? And whatever your child say, don't say that is just, no excuse. Just repeat what your child says. So you were using the phone because, you wanted to reach your friend. And then tell me a little bit more who you have been reaching, why, at this time of the moment. So the more you use the curiosity, the more you use the exploration, you are activating that thinking part of the brain. Because remember, we are all physicians. There is no way you can teach your child, you can help your child when your child thinking brain is hijacked. So make sure, unless you do these steps, no matter how good your recommendations will be, it is not going to pass their brain because the thinking brain is completely hijacked. So collaboratively explore with them, ask them whatever they are telling you, repeat with them, and then ask more questions in a more curiosity. And the fourth step is, then you share some strategies based on what you share. And the fifth step is, you reflect, based on what you have said. Many times parents would say, but I have done all these things. My one child listen, but other child don't listen. So don't compare your child. This is another good research I want to share with you from Dr. Thomas Boyd, Dandelion versus Orchid kids. So Dandelion is like a, it's like a, it's like a flower. पाकिस्तान में उधर पंजाब में तो हम उसको छुई का पौधा बोलते थे कि आप उसको फूंक मारते थे and you make a wish. So the characteristic of that plant is that it can grow anywhere. It can grow in Koita, it can grow in Punjab, it can grow in Miami, it can grow in US. It does not need much of the nourishment. And as compared to orchid, so orchid is like a rose flower. You need to proper time, proper light, proper water, proper care. Both dandelion and orchid plants, they have the potential to grow. But the dandelion kids don't need that much care, as compared to orchid. But the orchid, if you don't give them water properly, if you don't, light properly, if you if you hold them more firmly, they are not going to grow. So we need to understand as a parent that not compare, okay, okay, and there are so many examples. Chacha ke bete ko dekho, he's going to public school. I'm sending you to the private school. What's wrong with you? Why you are so spoiled? Because each child is different. In the same house with the same gene, with the same food, one child can be a different temperament. So I think I shared a couple of strategies. The family media plan I have shared, sleep I have shared, and relationship. The device-free dinners if we can have. And as a parent, we have to be role model for them if we want to implement these things. I think these are all in the same narrative, the family media plan that I was sharing before. So this is all the offline activities that you can have the child to do. This is another good website, commonsensemedia.org. So they have a lot of apps. So if your child is play any video game, so you can go on that website, again, a free website. You can see what that game is about, what are the reviews, what this website also have age-wise. If your child is 6-year-old, what games that your child can play, 10-year-old, what game they can play, what are the pros, what are the cons, and what are some, the guidelines. So this is a really good website as well. As a physician, this is another good website, International Association of Child and Adolescent Psychiatry and All Professional, APPNA.org. So they have resources. So most of the previous resources they have done mostly in the Western, in the US. But these IACAPAP has resources that have done in different countries, and they have in multiple languages as well. There are some digital well-being apps: Apple Screen Time, Google Family Link, Bark. So these are some books on the screen addiction. These are some books on parenting, power of showing up, Dr. Dan Siegel, nonviolent communication. These are some of so I'm a child story writer trying to work on age 4 to 10. But again, really grateful for the opportunity, and thank you for having me.
Thank you very much. Thank you very much, Dr. Zishan, for an excellent talk. I know this is a plenary talk, and normally we are not allowed questions, but maybe we can, because we have a very learned panel, maybe one or two very quick questions, and if you allow, I would start with that. One of the questions which we are often asked as a pediatrician, and I'm sure that's true for everybody else, the parents would walk into your clinic, and once you talk about the screen time and media, they ask you, what is an appropriate screen time for my child? So like a 10-year-old, a 15-year-old, or a 12-year-old. So what is an appropriate screen time? Because this day and age, we can't really say that there is no screen time. The children are going to have, their schools are oriented like that, and so on. So what is an appropriate screen time depending upon the age of a child?
No, thank you. Thank you for asking the question. I think American Academy of Pediatrics have a lot of guidelines age-wise, but in my clinical practice, what I have found that usually those guidelines are not effective in many families. So what I suggest is this, just like I shared with you, that I sit with the parents, tell me, the sleep schedule, and I ask the child, how long does it take for you to homework? And then, depending on some days, like especially in US, some days they may have more homework in some subjects, some days they may have more activities. So you can say, as long as you are doing this is activities, you help parents that, they can have maybe 2 hours or 1 hour during the weekday, 2 hours during the weekday. And then if they finish those things, they can have more on the weekend, as long as 4 things are happening, as long as they are sleeping on time, as long as they are finishing their homework, as long as, they are eating, and as long as they are doing their physical activities. So as long as those are happening, I don't get that set firm limits on the time. But if they are staying up late to the point that they are being late to the school, if they are missing out family, the dinner time, if their homework is delayed, that's where I, make more strict rules around the screen time. Yeah, but if they want a very concrete, so American Academy of Pediatrics, you can have that chart. They have the age-wise recommendation. But what I have in my private practice, I have found difficult for the parents, depending on their circumstances, to follow. and I don't want parents to feel more angry that this is a standard guideline my child is not following. Is it I'm a bad parent or they are doing wrong? But there are guidelines there, but practically those are the strategies that I
Thank you very much, Dr. Zishan. We will have one question from the audience as well. Dr. Bashir Abro wants to have a quick question, and after that we will proceed to the next talk.
Assalamu alaikum, Dr. Zishan. You see, there's no playgrounds for the children. There's no outing due to the inflation. There's security issues. This is the only game that the children are playing at home due to all these reasons. What is the alternate for this screen use?
That's another बहुत शुक्रिया. I think डिपेंड करता है कि बच्चे की क्या एज है. आप यकीन करेंगे हमारे बच्चे जो हैं they want parents time more than anything else. A lot of people talk about the quality time. In my humble opinion, quantity time also matters. Again, these are the genuine concerns, lack of playgrounds, security issues. But I would say कि कुछ चीज़ें एक तो ये है कि if we start spending time with the kids, उनसे पूछेंगे यार what they are interested, what we can do, in the home situation. And the other thing is, if I may say, is if we want our children to respect each other, respect us, or listen to us, I think we really have to respect our spouses. And as a man, as a husband, I think what is a very common in a home situation is, when the husband, as a father is very kind and gentle to his daughter and son, but being very angry and rude to the mother of those kids, there is no way we can teach our children the respect. So what we can do in the home situation, spend time, and I often say the more we spend time with our kids, the more they are going to test us. But don't condition your time with them with their behavior. You are going to learn, what your child is doing in that time. So spend as much time, whatever the simple activities you can have depending on their age, and whatever, the limited resources you have, but keep open to learn. And also, whenever we make mistakes, do it in a way that it will create more nurturing environment rather than more punitive environment.
Thank you very much.
Thank you very much, Dr. Zishan. Give him a big hand. Thank you.